Hi, this is Dr. Bob Dannenhoffer, Public Health Officer for Douglas County. This is our show for March the 5th. It's been just about a year since we've had our first case of COVID here in Douglas County. And we've been doing this for almost a year. So this is a chance for me to answer your questions. So if you put them in the chat, we'll get them. We had some people send us questions already at Facebook questions at douglaspublichealthnetwork.org. And we'll get to those first, but when we're done with those, we'll get to the questions that you have. As always, we start at the world level and then move down and tell us how things are going. So in the world, this is still an active pandemic. We had a lot of cases over the beginning of the year, and then they came down, but now they flattened. And in fact, I think they're starting to go up again, and that is a bit of a worry. The disease is still very active in the US, in Brazil, and in different parts of Europe. It really is interesting when you look in Europe, there are very hot places like the Czech Republic and then places around them like Germany that are relatively cool. Sweden is hot, but Norway and Finland around them is pretty cool. And we're seeing a lot of cases in the Middle East, and the Middle East is a worry. The other place that I see cases now is in Africa. Now, during this pandemic, Africa has had very, very, very few cases. And we don't know on those few cases in Africa was that there really weren't very many cases, or there were a lot of cases, but because their health system is pretty terrible, that we just didn't pick them up, and we haven't known. But we're now starting to see places like Botswana have a large number of cases, and that is a worry because certainly Africa has a less well-developed healthcare system than South America. And South America, of all of the continents, has had the worst. North America and South America have had the worst time of this. So we do worry when I start to see cases in Africa that this will spread, because if this disease is controlled in the US but is very active in other places in the world, it will get to the US, and we'll get to that later, how that happens. In the US, again, cases came sharply down in February, but now they're kind of flat at about 60,000 cases a day. That's a lot, and about 1,900 deaths a day. In fact, I think deaths are starting to creep up again. And that is a big worry. 1,900 deaths today is an enormous number of deaths, right? When a plane crashes and there's 100 deaths in one day, it's big news. Or if, people die in car wrecks or something else, 100 deaths is a lot of deaths. So when we have 1,900 deaths a day, it's very worrisome. The disease is still very active in Texas, Utah, New York, and Colorado. Of funny places, how would you guess? And in Oregon, again, the cases came down sharply, and now it's flat. We're starting to see a lot of cases. Remember Douglas County about 2 weeks ago. Now we're seeing Coos County and Jackson County. So there's something going on here in Southern Oregon that's causing an increased number of cases. So in Douglas County, we're down from our peak. You remember about 2 weeks ago, we were really in a bad state. We've come down now, still higher than we should be. And still more hospitalizations than we would like. Nursing homes have been quiet. We've not really had the previous nursing home that had a lot of cases, they're pretty much done. We're starting to see little cases in other places, so we're watching that carefully. We're seeing a lot of cases at schools and a lot of cases at workplaces. And so, for example, we have one small shop where almost everybody in the shop is now sick, so we do worry about that. Okay, well, let's get to your questions. I have a bunch of other things that we'll go through today if we get a little bit of extra time. But let's get to your questions. So again, if you have questions, do that. Now, there was a concern last week that I'm only getting a snippet of the questions, and you're right, I'm only getting a snippet of the questions. So one of our staff people works on these questions. And if you write in a really super long chat, it's hard for them to put that all in the questions here. So if you have a really long question, you should put it at Facebook questions, because then we don't have to do it on the fly. We can do it as we can have some time to get to it. All right, so let's see what we have here. All right. So Joanne says, is there an amount of time a person should wait to start receiving a vaccine after having COVID? And so the recommendation is after you have COVID, you probably have pretty good protection for 90 days. So you might want to wait 90 days to start getting your vaccine so that somebody who has no protection because they've not had the disease or a vaccine can get that vaccine and get them protection. There's no minimum time though. You can get the vaccine immediately after, but the recommendation is to wait 90 days. There was a study that came out last week that suggested after you have the disease, even after one dose of vaccine, you get a tremendous amount of protection, but that is not yet an approved change. So Paul says, how long after the second dose of vaccine before you attain immunity? And so there's not a day or a time. So when we looked at the studies, people started producing pretty good antibodies about a week or two after the first dose. Those antibodies then continue to rise in that month, and then after the second dose, they continue to rise further. In terms of protection from disease, when you looked at the placebo group and the treated group, in the first 2 weeks there was not much difference, and then that difference continued to diverge. So we are suggesting that you're not really considered immune until 14 days after the second dose. So 14 days after the second dose of Pfizer, Moderna, we're not sure yet about the J&J, but 14 days after the second dose of Pfizer, 14 days after the second dose of Moderna, you're probably at your maximal level of protection. And that's a good level of protection, 95% or so. The question is, should you have an antibody test? No. Unfortunately, the antibody tests are useful in a research point. They're not useful for an individual. We generally think that the higher number of antibodies, the better protection you'll have, and the lower level of antibodies, the less protection you'll have. But that's only general, and we do not yet have an antibody test that we're recommending. Jenna says, where can I get the J&J vaccine? It's just arriving now, and we may have a place for people to get that in 2 weeks. The J&J vaccine went to public health, but it also went to the 3 Bi-Mart stores in Douglas County. So if you're looking for J&J vaccine, you may be able to get it at one of the Bi-Mart stores. Yeah, so Casey says, why is age such a factor with this disease, or in other diseases like flu, it's not nearly as age specific? So when we look at the risks of dying from this disease, the lowest risk is in your teenage years. And so that as you are a teenager, your risk of dying from this is very low. But then by the time you get to be 40, it's about 100 times what it is as a teenager. By the time you get to be 80, it's 1,000 times what it was as a teenager. So there's an incredibly steep age gradient. And so what's going on there? Well, it may well be that there's something about getting older which makes you more prone. Now, we talk about an immune response, but I don't think it's that. I think actually most of the deaths that we see from this disease are because of their effects on the blood vessels. And so there's lots of effects of this disease on the blood vessels with clots. So you may remember that dancer who had clots and lost his legs. A lot of people have kidney disease, and the kidney disease is from clots in the kidneys. And we know there's a lot of clotting issues that happen with this. My sense on this is that babies and young people have incredibly smooth blood vessels. I mean, when you do autopsies, sadly, and look at young people, their vessels are incredibly smooth. I sort of like a newly laid street. So streets get repaved, and how wonderfully smooth the pavement is, but then after a while it gets roughed up. And similarly, when you look at the blood vessels from people who are older and older and older, those blood vessels now have plaques, they have breaks in it, all kinds of other issues. And I think this is an endothelial disease. And because the endothelium is more disrupted as we get older, just in general, people who are older are more likely to get it. I think we are going to go ahead and figure this out later on, but right now the sense is it probably has something to do with that. And that would suggest why some of the underlying conditions make it worse. Obesity, hypertension, diabetes, all wreak incredible havoc on the endothelial system. And so it may have something to do with the smoothness of the endothelial system, but we'll know with time. Talked about blood type the other day. What about AB? AB's in the middle, so O is better, B is bad, AB is in the middle. But it's not a huge factor. It's a 5 or 10% difference. Again, remember age, an 8,000 time difference between 10 and 80, blood type, a 5 or 10% difference. So it really is, age is really truly the biggest factor. And in fact, some places in the world, and some places in the US, rather than talk about underlying conditions and where you work and whether you're a teacher or whatever else, they have totally gone by age. So Connecticut and the UK, both of whom have had very effective vaccine programs, said, look, it's too complicated to figure out. If you're a plumber who visits an old person, you're not eligible. But if you're a plumber who works in an old person's home, you are eligible. That is like so hard to figure out. And the difference in risk between those two people is so hard to know. Far and away, the best predictor of risk is age. So Connecticut and the UK started at people over 80 and then moved their way down, because that's pretty obvious. Everybody has a birth date and just a single birth date. So if somebody gets vaccine out of the county, is Douglas County notified? So this is complicated. So if somebody gets vaccinated, their vaccine data goes into a system called the Oregon Immunization Alert System. And it's recorded both where you got the vaccine and where your county of residence is. So if you're a Douglas County resident and let's say you work up at Sacred Heart and you got vaccinated at Sacred Heart, that vaccine would be credited to the people in Sacred Heart who gave it to you and to the county where you lived, which is Douglas County. The problem is it doesn't happen between states. So if you live in Douglas County and say work in Sacramento and got your vaccine there, it doesn't go across states. And the system doesn't work for the VA and the tribes. So vaccines that are recorded, let's say you're a veteran and went to the VA, those vaccines are recorded at the federal level, but then they don't get recorded back to this level. So it is very complicated. Very complicated, no. So the question is, how many have been vaccinated so far? So the OHA has their list and they have the number of people in Douglas County, but we know that the VA has done thousands of vaccines. We know that Cow Creek has done thousands of vaccines. And so our numbers are thousands more than you see on the state level. We're about average in the state, but it's so hard to know because we don't have access to the VA data and the Cow Creek data. I was on a call with Senator Wyden's office this week to see if we could somehow get that data. But so far we're doing okay. So Clover says, I heard that Lane County has no ICU patients. How serious are current hospitalizations? Yeah, I'd heard that. I think it was a little confusing because there are some ICU patients there, but in general, hospitalizations and ICU admissions are down in much of the state, except in Douglas County. We saw 14% of the 14 people in the hospital, and we've got people at Mercy, some of the PCU, some of the ICU. We have people at Riverbend, people at OHSU. These are people who've been sick for weeks or months, and so they're all over the place, but we still have some people who are really very, very, very sick. So Rochelle says, in terms of being contagious, if somebody tests positive today, are they still contagious or were they already contagious? So it makes a difference what kind of test you get. So we'll do a month where on the first of the month, you got infected. So on the first of the month, you were around somebody who was sick and you got infected. Typically what would happen is by the third or fourth of the month, your PCR test would be positive. Your rapid test would likely not be positive. By the 5th or 6th of the month, you would likely be developing symptoms. At that time, your PCR test would be positive, your rapid test would be positive, and you would have symptoms. Between the 5th and 12th day of the illness, so between the 5th and 12th day after exposure, both the PCR and the rapid test would be positive, and you would be contagious. 10 days after the start of your symptoms, your contagiousness goes away, your rapid test becomes normal, but your PCR test can stay positive for weeks or even months later. So this is all incredibly fact specific. So people say, hey, am I contagious? It's okay, I have to know a bunch of things. When were you tested? What test did you have? What were the test results? When was your first day of symptoms? Do you have underlying conditions? And getting all of that, we can answer the question. So we'll get back here. If somebody tested positive today, are they still contagious? Well, it matters what test they tested with. If they tested positive on the rapid antigen test, yes. If they tested positive on the PCR, perhaps. So for example, we have people, again, got exposed on the 1st, developed symptoms on the 5th. Their PCR was positive on the 5th. You tested again, it was positive on the 10th. It may be positive the entire month, but you'll probably only be contagious for 10 days after the onset of symptoms. Have there been no outbreaks in schools? No, sadly, there have been a lot of outbreaks in schools. So we have 38 current school outbreaks. And a current school outbreak is an outbreak within the last month, because outbreaks are continued for two long incubation periods, and 2 long incubations is 28 days after the last case. We have 38 active school outbreaks, and almost every day we're hearing about another 1 or 2, and it's really been really quite disruptive. So tonight we're supposed to have football games at Roseburg, Douglas, and Camas. I believe all of those got canceled because someone on the team had COVID. So there have been a lot of school outbreaks. And again, these school outbreaks we do not think are really necessarily spreading in the classroom, but they're spreading when people hang out together before and after practice. Once you go to school, you think it's probably okay to have a sleepover, go to a friend's house to play video games, and that's where we're seeing these things spread. Okay, well, a couple of interesting things. There's something called COVID arm. So there are some people who are noting that a week or so after getting their COVID shot, they have sort of a red, itchy, rashy arm that has been dubbed COVID arm. So it's called a Latehypersensitivity reaction, like we see with other things, and it's just basically an immune response that happens a week or so later with redness, itchiness, soreness, whatever. It goes away usually in 3 or 4 days, and is not at all serious, and is not a reason not to get another shot, even if you need to get your second COVID shot. You can treat it with ibuprofen, but not serious. The other one that we're seeing is that people will sometimes develop lymph nodes a week or so after they get the shot. And again, if you develop those, about 3 or 4% of the people in the studies did that. It is not serious. They usually go away in 4 to 6 weeks. 2 things. A new study came out on ivermectin. So you remember ivermectin is an anti-parasitic drug. Probably your animals are taking it to prevent heartworm. And humans take it sometimes to prevent things like head lice. And so it's a very nice anti-parasitic drug that's been in wide use in both human and veterinary practice for a while. There are some people who just absolutely swear that it is an absolute miracle. And it's weird because there are a lot of studies out there. Some show a little improvement, some show nothing. It's kind of a mixed bag. They did one recently, a very nice study, a randomized control study. That is, they took people who just had the disease. They gave everybody pills. Some of the pills were placebo. Some of the pills were active pills, and they looked to see how they did. Not a big difference. Maybe a slight improvement with ivermectin, but certainly this is no miracle drug. The other one, which is one I've been talking about now for 8 weeks, which is ivermectin. So ivermectin is fluvoxamine. So fluvoxamine is a drug that we use to treat depression. It's a drug that we use to treat obsessive compulsive disorder. Seems to be safe and effective for those conditions. In France, they recognized that when this disease went through a psychiatric hospital, that people who were on fluvoxamine had much less trouble with this than people who were on other drugs, and they wondered if the fluvoxamine was somehow a protectant. And it could be because there's a specific receptor that fluvoxamine works for, which is also involved with COVID. And so there was a very nice study that was done where they found people who just had the disease And again, they said, here, take a pill. Some took fluvoxamine and some took placebo. And the people who took fluvoxamine did much better than the people who took placebo. Again, fluvoxamine appears to be very safe. We don't know whether or not it's effective. The reason I'm doing this is that this weekend apparently there's going to be a story on 60 Minutes about fluvoxamine. So I'm sure if I don't have any questions tonight about fluvoxamine, next week I surely will. All right, let's go through. We have a few more questions here. So Kat says, in the past you said nearly all cases are due to a lapse in behavior and masking. Is that still the case? Yes. I mean, in almost all the times where people get the disease and we can track it back, which is really a lot of the cases, people didn't do something right. I mean, they had a sleepover. Okay, so a sleepover, a lot of gathering, one person sick in the sleepover. And again, I'm not saying that, I'm not blaming people for doing that. I mean, when I was a kid, we did sleepovers too. And it's not like you would ask people to wear a mask or distance during a sleepover, but it does, you have people together. In workplaces where we see it, people will grudgingly admit that they weren't great at wearing masks or whatever. The one area where we think people have been doing a good job and yet they're still spread is in nursing homes. And we're not exactly sure what happens there, but in nursing homes, even though people do wear masks and whatever else, there has been some spread in nursing homes, and we're just concerned with that. So Clover says, how bad is the spread in schools? Well, again, we don't think this is, in fact, we can't find any cases, we think, where it actually spreads from student A to student B in class. But when kids are back in school, kids do the things that kids do. They hang out together at the bus stop. They invite each other over to sleepovers. They go to birthday parties. For people on sports teams, they hang out at somebody's house before or after practice. Somebody else gives somebody a ride to practice, so they drive in the car to practice without wearing a mask. And it's those kind of things which we think are spreading the disease. Now, anybody who's played sports recognizes that hanging out with your teammates before and after practice is a lot of what sports is about, right? So sports is a little bit about winning the games, but it's about forming teamship. It's about leadership qualities. It's about bringing a group of disparate individuals together. And some of that doesn't happen on the field. Some of it happens before and after. So, Dana says, if a child has been quarantined because of contact with a positive case and have received a letter that their quarantine is over, should they get tested before returning to school? So there's 3 ways to end quarantine. So one is to do 14 days, in which case no testing is required. The second is to do 10 days. Again, no testing is required, but we ask people to self-monitor on the 11th, 12th, 13th, and 14th day. Or you can quarantine for 7 days with a negative test on the 5th, 6th, or 7th day, and then continue to self-monitor. So it makes a difference how long the quarantine is. Most of the school quarantines we're doing are 10 days, in which case you do not need to get a test. If you want to get a test, I think that's okay. But there's no need to get a test if you've been quarantined for 10 days. So Tanya says, the shingles vaccine about did me in. What if you're symptomatic but don't know if you're positive? Should I still get the shot or should I be tested first? So the shingles vaccine is a different kind of vaccine. It's a vaccine that has a thing called an adjuvant, and it's something that boosts the immune response. But I will tell you the reactions to the shingles vaccine, the Shingrix vaccine, and to the COVID vaccine is pretty similar, with the red arm and the feeling tired and weak thereafter. So Tanya says, if I'm symptomatic, should I get the shot? Well, if you're symptomatic, you should stay home. There's no way you should go out to get a vaccine if you're symptomatic. If you're symptomatic, you should stay home. You should stay home. Don't go out. Now, you might go out to get a test, but other than that, don't go out. I will tell you the number of cases we've seen recently where people went back to work while they were symptomatic is just stunning. So in one case we recently had where somebody went back to work and they exposed hundreds of people. And so really, truly, if you're symptomatic, you should stay home, except maybe to get tested. You shouldn't think about going out for a vaccine. You shouldn't think about going out for anything if you are symptomatic. So Lane says, if you had a reaction to the first shot, will the reaction be less on the second vaccine? Well, there's no way to predict for any individual person. There's some people who had a big reaction on the first and then no reaction on the second. But in general, the reaction on the second vaccine is more than the reaction on the first vaccine. So in general, it's worse the second time than the first. Yeah, so Dale Ann says, any suggestion on how to respond to a relative that says the vaccine is a big part of a big plot to reduce world population? Well, I mean, hard to know what to make of that, right? Really hard to believe that the Trump administration and the Biden administration would be in some deep, dark room saying, we want to reduce the world's population. I mean, that makes so little, that makes like no sense to me. There's nothing to suggest that this vaccine is going to do anything other than prevent COVID. And the best way to reduce the world's population is not to have a vaccine. Let the vaccine sweep through the world. 2.5 million people have died of this. Now, there's 8 billion people in the world, right? So it's not like the deaths that we've had from COVID have already reduced the world's population, but certainly the vaccine is not going to reduce the world's population. So I don't know what to say that. So I get these kinds of things all the time, and people say it's going to cause me to be sterile, it's going to cause me to grow a third arm. I say, oh great, can you show me the research that says that? And either they can't, or what they show is stuff that isn't real. And there's a bunch of stuff that isn't real because anybody can say stuff on the internet that looks just as real as the stuff that is real. And so, I don't know, but there's certainly nothing to suggest that it's part of a big plot to reduce the world population. So what is the percentage of people testing positive for COVID that are asymptomatic? It's very low. So the only people that we're finding who are testing positive or asymptomatic are people who are in nursing homes. So what happens when there's a case in a nursing home, they test everybody every couple of days. So they do a tremendous number of tests, and we'll occasionally find people who are positive but asymptomatic. We do not find, almost all the cases we find are through traditional testing are symptomatic, because that's typically the way that people get tested. Now, we are testing other people who are, for example, pre-op. Let's say I'm going in to have my knee replaced. They would do a test that way. We find an occasional person who is positive on a preoperative or pre-hospital admission, or they get admitted for something else. So we had a fellow that was involved in a chase, and he broke his leg and needed to have surgery. And before they did the surgery, they found he was COVID positive. I would say those are occasional. Vanessa's on the thing, probably less than a dozen in the whole time. So it does happen, but not very commonly. So Sky says, should you take NSAIDs or Tylenol before the vaccine? Could it hinder antibodies? So there's no studies on the COVID vaccines. We do know in kids, we give a lot of vaccines. We do so many vaccines. So I look, it's over 1 million vaccines that I've given in the 40 years I've been in pediatrics, so a lot of vaccines. And so we give a lot of vaccines, especially babies. They'll sometimes get fevers, and the parents will sometimes want to give them Tylenol or Ibuprofen. So they've done a bunch of studies on childhood vaccines to see if giving kids Tylenol or Ibuprofen changes the immune response. And it does statistically differently, but practically no difference. And so that if a kid comes in and mom says, oh, he had a big fever last time, can I give him Tylenol? Absolutely. Can I give him Ibuprofen? Absolutely. That statistical difference in the amount of antibody produced is probably not significant. Now, on the other hand, I wouldn't recommend that everybody take Tylenol or everybody take Ibuprofen prophylactically, because if you don't need to take it, then don't take it. So I don't think people need to worry about NSAIDs or Tylenol. I think any of the difference is just theoretical. So Gabrielle says, when things are better, I can only hope. When things are better and we can start gathering again, should we be concerned about being around people who aren't vaccinated? Yeah, I think so. So again, remember, people want to give it's safe or not safe. It's never black or white. It's always totally gray. You go from the really safe arrangement, not very much disease in the community, everybody vaccinated, the risk of you bringing it to each other, very low. A time now when there's a good amount of disease in the community, not very many people vaccinated, the chance of spread pretty high. And so now I would take a lot of precautions, meaning a lot of gatherings, wearing masks, social distancing. But we'll get to a time this summer where if everybody in the party is vaccinated and there's 4 cases a day in Douglas County, I think it's going to be a much safer arrangement. Now, notice what I said is not safe arrangement, but just much safer. I mean, think about this like driving in the car. If you have a nice new car, you're wide awake and alert, it's a bright sunny day, and you're a good attentive driver, your risk of getting in an accident is small, but not zero. Even with all of that, you could still get into an accident. On the other hand, if you're driving drunk, tired, fast, in a crapo car, your chance of dying is going to be a lot higher. And so, but not 100%, right? There are people who do that, drunk drive too fast and don't die every time they do it. And so you're talking about things that are safer and less safe. So in the summertime we get it, it'll be much, much, much safer. It'll be much, much, much safer. So Catherine asked an interesting question. Are there any comments on the vaccine reducing symptoms of COVID for long haulers? That I'm sure is going to get studied, has not yet been studied. So COVID long haulers are people who've had the disease weeks or months ago and still have symptoms. They are eligible for the vaccine. And so it'll be interesting to see if that changes their long haul COVID symptoms. I would guess not, because we think the long haul COVID symptoms are probably not related to the virus, but probably to the body's reaction to the virus. So I don't think the vaccine is going to change your body's previous reaction to the virus, but it'll be very interesting to see if it makes a difference. The other question is, will there be people who get the vaccine, get an asymptomatic case of the disease and have long hauler? Hard to know. We don't think so. But we don't think so. So what we really think is we just want to decrease the amount of disease in the community. And by decreasing the amount of disease in the community, it'll make other activities much safer. By decreasing the amount of disease in the community, it's going to make transmission much less likely. And by decreasing the amount of disease in the community, it's going to make mutations happen less. So the mutations or the variants are very worrisome. And mutations occur where the disease is circulating. Mutations do not occur when the disease is not circulating. And so we want people to be really careful at this time, because those variants or mutations are potentially really, 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 really dangerous. Okay, looks like we can get to the end of the questions, which on a rainy Friday afternoon is not all a bad thing. There are just a couple things I want to point out. One is that the Johnson & Johnson vaccine, which is a single-dose vaccine, finally did arrive in Douglas County this week. About 100 doses of that went to each of the Bi-Mart stores, and they have it available, and 1,200 doses went to the county. We're going to be using that, working with Umpqua Valley Ambulance to deliver to people who are homebound, either because of illness or people in adult foster homes. We're also been told we need to vaccinate the people in the jail, and we'll likely be using the J&J vaccine for that. In addition, next Tuesday, when we do this, we'll talk about an event that's going to happen in the near future, a drive-through event at the fairgrounds, where we're going to be able to use some of the additional vaccine that we got this week for that big event coming up soon. That's going to be an event for seniors, but our goal is to get all of the seniors, anybody 65 and above, to get their first vaccine in March. Now, I don't think we're going to be 100%, but we're very close to. I think we'll be very close to getting everybody 65 and above one dose of vaccine in March, and that's my absolute goal to get that done, because after March, then we're going to start working on other people with underlying conditions, people maybe in some frontline occupations, and so we really want to get done with the seniors so we can do those other groups. Those other groups, we do not know when they're going to start. We hope they're going to start somewhere around the end of March or the beginning of April. And that's why March has got to be our time to get as many first doses into seniors as we can. We think we've gotten most of the 1A population done. We think we've gotten most of the educator population done. And so now March, our number one goal is to work on our seniors. Okay, well, if there's no more questions, we'll call this a night, which will be a good thing on a rainy Friday night, probably a good night to stay in, stay warm, and celebrate with family. Again, things are getting better, but we're clearly not over, so still be careful. We think distancing is important. We think mixing households is really risky. We think wearing masks helps, and certainly if you're sick, please stay home. Again, the 1 or 2 days of work that you're gonna not miss, you may now cause 100 people to miss 10 days. And the calculus on this is enormous. So we've had 3 cases when this last week where people got a rapid test and a PCR test. They either got the rapid test too early or too late, and so the rapid test was negative, but the PCR test then came back positive. In those cases, they went to work in the time between the rapid test and still the pending PCR test. In those cases, if you expose, say, 20 other people now need to stay home, they each need to stay home now for 10 days. Now, they're not all work days, but it's going to be like 140 or 150 work days that other people are going to miss because you went to work in that time. And so I know in the U.S. we're not good at staying home when we're sick, but we really have to get there this year to stay home when we're sick. So Sherry, it's the last few questions. So Sherry says, have you received any results of testing for the Brazil variant again in Douglas County? So we sent off the variant analysis for that first case back in January. We got the results on the 1st of March. We have about 30 other specimens out there now that we're waiting on results. So we'll see that. We've not gotten any other results back yet. And again, this is one of the great disappointments in this country. We're not doing enough variant testing. There are other places that do a lot, right? So Britain does 5 or 10% of all positive specimens. Denmark does 100% of all positive specimens. We do 1 in 300 at best. And so we do very few, and we're taking a long time to get them back. You know, it really is not great to do the test in January and get it back in March. Because what happens is when people get the disease, the next generation is 5 or 6 days later, the next generation 5 or 6 days later. So as we go out 30 days to get the results, we're out 5 or 6 generations. And we're really good at following this, but it's really hard to follow this disease any more than 3 generations. And the reason it's hard to follow for 3 generations is there's some asymptomatic disease in there, and following somebody who's asymptomatic is nearly impossible to do. So we're really good at following this, but we can rarely get back 3 generations, or rarely go forward more than 3 generations. So Stephanie says, if you get COVID arm the first time, are you more likely to have a harder time with the second dose? The answer is we don't know. So the COVID arm is usually after the second dose more than the first dose. But if you get a COVID arm the first time, you could get that again. And again, it's a bother, but not really serious. And Tanya says, is my mom okay? She is a tough old bird. At 91, she is still great. You know, we play cards with her by video. So my son and daughter-in-law are great card players, and so is grandma. But I will tell you, she wins almost all the time. She's amazing at what a card shark she is at 91, and she's good at Jeopardy and Scrabble and all those things. I would hope to be half as sharp with her as she is at 65 as she is at 91. So she is pretty great. Anyway, so thank you all. We'll do this again on Tuesday. Dr. Bob Dannenhoffer, the Public Health Officer of Douglas County. Thank you.